normally wear this mask, but this is not sufficient to see COVID-19 patients. So I have to have N95 respirator, and this is it. And I'll be duck face to see my patients. And this is how I will. And still, I need to protect my eyes with these glasses. And I'm gonna wear cap when I go there. Here you go. So this is COVID unit. Each room is closed with negative pressure, so air cannot come out, and everyone is covered with proper equipment. There are instructions in each room outside that what kind of precaution you need to take. So these are the instructions in each room that you have to first wash the hands, use N95 mask or paper to cover your face, then use gloves and gown and then cap. Followed by that, you use stethoscope which is available inside to examine the patient, and then you keep the door closed. So first you do hand hygiene. Once hand hygiene is done, then you have your mask, that is N95, your face shield, that is eye shield, and then you have your gown, which is covered. Then you make sure that it's in your back, nicely covered. Once it's done, your gloves. Should be completely covered. Now keep eye care. After this, you're good to go. Let's go save some patient. So as I told you, this is called N95 mask and this is face shield. But if you are not fit tested, if you have beard, then you can use this. Here is my friend Dr. Ja. He is wearing pepper, and can you just bend? Yeah, there is a back where you can have this machine which is giving you air inside the pepper, and pepper is all covered, and you can see that it is covered nicely so that you are protected and well sealed. Any air that goes inside the pepper, it actually comes out. Nothing comes inside without. There is a filter located in the back of this machine, and that filter clears the air and then it goes in so that most of the admitted COVID-19 patients are requiring oxygen. Based on their requirement, there are different types of oxygen delivery. We will try to learn basics about it. So this is nasal cannula oxygen, which is basic of beginning step of oxygen delivery. Two prongs of a nasal cannula are going inside your nose. It can deliver from 1 liter up to 10 liter of oxygen, but ideally we keep it up to 6 liters. And then if it is more needed, then we try different forms of delivery. There are face masks, they are available. There are non-rebreather masks, they are available that we use. But in the beginning step of low oxygen saturation or low oxygen level in your body, we start with this nasal cannula oxygen. If oxygen level drops down further, the next step is using high flow nasal cannula oxygen. It can deliver up to 60 liters of oxygen. It has thick prongs inside the nose, controlled with machine. However, often patients feel difficulty in breathing and they are tired, they cannot maintain their oxygen saturation. In that case, we use BiPAP, which is bilevel positive airway pressure machine. There is a mask which is sealed tight on your face, and then
patient's breathing will be further supported by the pressurized air given by the machine. However, if patient still is having difficulty breathing, then last resort is putting patient on ventilator. So ventilator breathes for the patient and patient has to be kept in sleeping mode. So medications were given to make patient sleep and it is monitored closely in ICU about patient's progress, and once patient recovers, then ventilator slowly can be weaned down to regular oxygen supply. But it depends on how patient recovers. Sometimes they don't, then it is challenging.
So I saw a patient just now who was in ICU, required ventilation through ventilator for almost 10 days. He is now back on the floor and he can talk, he can eat, and he is now just on nasal cannula oxygen. And that is just because of COVID-19 pneumonia. No doubt or mention to say that he got a lot of other complications. So my last patient was a sad story. She was very elderly. She could not do well with the COVID. So finally we had to talk to patient and we kept her comfortable, and we are hoping that as long as she lives happy, she lives comfortable. So we are giving some medications for end of life and comfort. Yes, COVID takes a toll, and whatever we can do, we do our best. May God bless us. So after my long round, finally, I'm back to my office finishing notes, and for that, I'm gonna remove this. And if I remove, I get this, the marks, the COVID-19 marks. But I'm happy that I can take care of the patient, whatever I can do to serve the community. Now I'm real hungry, so I'm gonna eat. And look, where am I? So after lunch, main job is document and address urgent issues, whatever happens with the patient, and documentation. This is how it goes. You open the computer, open the patient's chart, and then you go with this. Patient is in an exam today, period. So after my long streak of writing patient's note, and after one rapid response, here finally I feel that I have completed my work. But still one thing is pending, that is to talk to patient's family. So I'm on it still. Hey, this is Dr. Patel speaking. How can I help you? Hope you have learned something while seeing our life. COVID is very dangerous. What we see inside the hospital is beyond our imagination. Please stay home, stay safe, and all the time, please wear mask. Please take care of your loved ones and take care of yourself. I'll see you in next. Take care.